Okay, come to session number 15, in which we are going to discuss pharmacotherapy of aspiration pneumonia and pneumonia in cattle and goat. So we will be discussing aspiration pneumonia and also pneumonia in cattle and goat. By beginning, pneumonia is an inflammation of the pulmonary parenchyma and usually is accompanied by inflammation of the bronchioles and often by pleuris. So pleuris is the inflammation of the pleura. Pleura, I think you remember pleura, that space between the lung and the outer space of the lung, and also that operates between the lung parenchyma and the ribs. Pleura, that is pleura, in which in between the spaces of pleura there is air. So these thin layers over the lung, between the lung and the ribs, the pleura, can undergo inflammation. So inflammation of the pleura, which is pleuris, is the sign of pneumonia. So pneumonia can be an inflammation of the parenchyma, or can be inflammation of the bronchioles, and also can be the inflammation of the pleura. Important pathogens that can cause pneumonia in cattle include Menhemia hemolytica serotype A, Haemophilus somnus, which is also known as Histophilus somni, Pasteurella multisoda, and this Pasteurella multisoda. In most cases, it is a normal flora of the respiratory tract, and sometimes can happen to cause disease in the animals. Mycobacterium bovis, Mycoplasma mycoides, parainfluenza virus, bovine respiratory syncytial virus, and bovine herpes virus type 1. So all these microorganisms can cause pneumonia in cattle. Most signs and symptoms of pneumonia in cattle include increased respiratory rate, cough, abnormal breathing sound, or escalation. So when you listen with the stethoscope, that is escalation. When you listen with the stethoscope in the lungs of the animal, you will hear abnormal breath sound. And in most bacterial pneumonia, they can show toxemia, or the poisoning or toxicity from the poisons of the bacteria, toxemia. So bronchopneumonia, pneumonia of the bronchioles, is usually accompanied by moist, painful cough. So when the animal coughs, there is pain in the cough when the animal coughs. So you will see that the animal is experiencing pain when coughing. Interstitial pneumonia is characterized by frequent hacking coughs, often paroxysms. These coughs that happen in the animal, the frequent and hacking coughs, they happen suddenly. So in Swahili we can say vikohozi vya kushtukiza. So there are some kind of coughs, paroxysms. They happen just unexpectedly, with the no information it happens. Kwa kile kikohozi cha kushtukiza ndio hiyo paroxysms, the cough that is often paroxysm. Presence of nasal discharge depends on the accompanying inflammation of the upper respiratory tract. So sometimes nasal discharge can be seen in these animals. So the way to treat the animals, the pneumonia in animals, can use sulfamethoxine, and that is the maintenance dose and the initial dose. Procaine penicillin G, ampicillin trihydrate, amoxicillin trihydrate, oxtetracycline hydrochloride, and also tylosine can also be used for treatment of pneumonia in cattle. And prevention, you can go and look for the prevention measures for pneumonia in cattle. You can look for that, but we will discuss some points here. You can read more, but some of the points include that there are multifactorial issues of the disease, control program rely on the appropriate vaccine strategy, so vaccination, alongside improvement of the management practice to reduce the risk of disease. Also providing the calf housing with good ventilation, plenty of air, and no droughts, and also a well-bedded dry area. So you maintain a dry area in order to avoid breeding of the microorganisms, but also ventilation, enough air. So you can see this disease is a respiratory disease, so air is very important to be enough in the area where animals are living, especially calves, the young cow. Sometimes it is very important to prevent, score, and manage outbreak properly if they occur. Also prevent BVD, which is bovine viral diarrhea, in a head through culling, selective slaughter, and testing practice. So sometimes if these animals are so many, they are so many in one place, they can be affected by the disease bovine viral diarrhea. And this disease can cause dropping of the animal immunity or immune system ability to fight diseases. So by this disease, the immune system goes down, and then you can see the normal flora overgrow and cause the pneumonia. So in order to prevent the disease pneumonia, you can make sure that you prevent this BVD. And by preventing BVD, you can prevent it by slaughtering, selective slaughtering. So you select some of the animals, you slaughter them in order to reduce the population of the animals, and that is culling. Culling is selecting the animal and slaughtering in order or for the purpose of reducing the population of the animal, and also testing practices. Test frequently to see if the animals are having the pneumonia. Outdoor reared calves are generally at low risk of pneumonia. So those animals which are outdoor, they are living outside. They are not impounded inside the building. So if they are outdoor calves or the outdoor cows or outdoor goats, so they have low risk of developing pneumonia. So indoor rearing is not good because it can bring these kind of diseases, and outdoor will be preferred more in order to lower the risk of pneumonia. So vaccination can be given, and vaccines are available that will enhance protection against the common viral and some of the bacteria causing pneumonia. And calves can be vaccinated by using within 2 weeks of age, they can be vaccinated uh, by the IBR vaccine. And this vaccine is an infectious bovine rhinotronchitis vaccine. So this vaccine prevents these diseases which affects the respiratory system. And when the respiratory system is affected, then the animal is very prone to get pneumonia. So in order to prevent the occurrence of the pneumonia, also you can give the vaccination for this disease known as infectious bovine rhinotronchitis. Vaccination program is 2 shots for 4 weeks apart. So we give 2 shots in the distance of about 4 weeks between those 2 shots. And a booster dose should be given before the next risky period. So sometime the vaccination can need or can require booster dose. Several species of the bacteria can be isolated from the animal, from cattle. From cattle, we have seen all these species can cause disease in cattle. And also among these microorganisms, Mycobacteria hemolytica, Pasteurella multisoda, or these are the most important bacteria involved in cattle pneumonia. So these these microorganisms, the Menhenia hemolytica, the Pasteurella hemolytica, which was formerly known as Pasteurella hemolytica. This one, let us put it like this. So this one was also known as Pasteurella hemolytica, but now it is known as Menhenia hemolytica. And Pasteurella multisoda, these are the common Maltosida, these are the common important bacteria which are involved in cattle pneumonia. So they are the common cause of pneumonia in cattle. Early recognition by trained personnel skilled at detecting the early clinical signs of the disease, followed by treatment with antibiotic, is essential for a successful therapy. So trained personnel which can detect early signs of the pneumonia in cattle is very important, in which by capturing early signs and symptoms of the disease, the cattle can begin treatment in order to prevent a worse condition of the disease and to treat it by the antibiotics we discussed previously. So that was about pneumonia, but we have another disease which is aspiration pneumonia. That was pneumonia, now this is aspiration pneumonia. Aspiration pneumonia is a common type of pneumonia that is caused by aspiration or inhaling of the foreign material into the lungs. So aspiration here, we are talking about inhaling something new into the lung. That's something that has been inhaled into the lung causes the infection of pneumonia. So the most common cause of aspiration, now inhaling something. So what is that something? Most of the time, this something that is inhaled into the lungs is when we administer medicines to the animals. So especially some type of administration of medicine in the animals can be difficult in such a way that the animal can inhale, if it is a tablet or whatever, into the lungs. And especially the method when the tongue is pulled out in order to propagate the medicine inside the GIT, the animal can inhale the medication into the lungs. And also the head, when the head is held high, so you hold the head of the animal high in order for the animal to swallow the drugs, but unexpectedly the animal can inhale the medicine into the lungs. Sometime during coughing or during bellowing, when the animal takes a deep loud roar. So a deep loud roar can cause the animal to aspirate something. So aspiration tunamaanisha kwamba kitu kinaingia kwenye njia ya hewa, kitu kuingia njia ya hewa. Kwa vitu vikiingia njia ya hewa vinaweza kuleta pneumonia. Hiyo inaitwa aspiration pneumonia. Na mara nyingi vitu hivyo ni kama dawa. Kwa kuna baadhi ya dawa wakati wa kuwapa wanyama, kuna style jinsi ya kuwapa ambazo zinaweza zikasababisha hiyo dawa ikaingia kwenye njia ya hewa ambayo baadaye inaleta pneumonia. So pia kwenye kukohoa, mnyama anaweza kakohoa, lakini akikohoa unajua ukishakohoa kuna hewa nyingi unavuta ndani. So mnyama anapokohoa alafu akavuta hewa ndani, anaweza akavuta vitu ambavyo vimemzunguka vikaingia kwenye njia ya hewa alafu vikamuathiri. Lakini pia anapokuwa anatoa mlio mkubwa, ndio inaitwa bellowing. Akatoa mlio mkubwa, then kabla hajatoa ule mlio mkubwa huwa anavuta hewa ndani. Kwa kuwa anavuta, anaweza kavuta some particles around ambazo zinaweza zikamsababishia pneumonia, vumbi na nini, dust and so forth, some speckles and some things around. Vikiingia kwenye njia ya hewa vinamsababishia hiyo pneumonia. Also other predisposing causes include the aspiration of vomiters. Sometimes wanaweza matapishi yanaweza yakamuingia kwenye njia ya hewa. Kuna wale wanyama ambao wako anesthetized au comatose animal, wale wanyama ambao hawajitambui au wamepoteza fahamu. Vagal paralysis, acute pharyngitis, abscess or tumors in pharyngeal region and cleft palate. Kwa wale wanyama ambao wana paralysis kwenye njia ya hewa, lakini pia wenye acute pharyngitis, inflammation of the pharynx, abscess au tumor, viuvimbe katika pharynx, na pia cleft palate kwa wale wanyama ambao kuna uwazi juu ya taya la juu, kutakuwa na uwazi. Kwa binadamu inaitwaga mdomo sungura, lakini kwa wanyama sijui inaitwa cleft palate. Kunakuwa na uwazi kwenye eneo la juu la mdomo, kwenye taya, yani ile roof of the mouth, sehemu ya juu ya ndani ya mdomo inakuwa wazi, maanake inaunganika na pua. Kwa kukiwa na hilo tatizo la cleft palate ambalo mnyama anazaliwa nalo, linaweza kusababisha aspiration pneumonia. It is most common problem because most cattle owners attempted to drench traditional medicine before consulting an animal health professional. So aspiration pneumonia inatokea sana kwa wanyama. Kwa nini? Kwa sababu watu wengi wanajaribu kuwapa wanyama kienyeji, wanawapa wanyama dawa kienyeji bila kuongea na wataalamu wa afya ya wanyama. Kwa wanapowapa wanyama dawa kienyeji, unakuta unakosea jinsi ya kuwapa dawa, basi ile dawa inapita kwenye njia ya hewa, mnyama anapata pneumonia. So clinical signs, diagnosis and the treatment of aspiration pneumonia in goats are similar to that of cattle. Kwa aspiration pneumonia iko sawa na ile pneumonia, lakini kwenye mbuzi na ng'ombe iko sawa. And signs of this aspiration pneumonia is fluid sound over one or both sides of the chest, followed by wheezing sounds, pleurotic friction raps, and sometimes crackling sound of subcutaneous emphysema. So kunakuwa na sound kama kuna maji kwenye mapafu. Kwa hiyo mnyama anaanza kutoa sauti. Anapopumua kunakuwa na sauti za miluzi miluzi. Kunakuwa na friction and the friction raps, kwa unasikia kama kuna friction, kama kuna vitu vinakwaruzana ndani ya mbavu. Lakini pia kunakuwa na sauti wakati wa kupumua, crackling sound, kama kuna vitu huko ndani vinakwanguana hivi. So hizo sauti utazisikia ukisikiliza na stethoscope kwenye mapafu au kwenye eneo la mbavu la mnyama huyo. Toxemia may occur in ruminal fluid when ruminal fluid is aspirated. Kwa kuna maji yanaweza kujaa kwenye mapafu, lakini pia kuna maji yanaweza kujaa kwenye GIT. Kwa ukivuta yale maji ukayaangalia, unakuta yana contain toxins from the bacteria. Kwa unagundua hapo kuna toxemia. So sometimes toxemia can happen, and that toxemia is common in the ruminal fluid. Pharmacological treatment of aspiration pneumonia is the same as pneumonia, in which we use antibiotics, especially the penicillins are used. Procaine penicillin, benzathine penicillin, and amoxicillin can be used for treatment of this disease. That is it about pneumonia. But we shall have assignment 1, and this is an individual assignment. So this is our assignment 1, which is individual assignment. So you will do it on your own and you submit on your own. So this assignment 1 is about describing 5 groups of ectoparasites and their pharmacological treatment in cattle, goat, pigs, dogs, and cats. So we have 5 groups of animals: cattle, goat, pigs, dogs, and cats. In all these animals, you are going to describe 5 groups of ectoparasites and their pharmacological treatment. So there are 5 groups of ectoparasite. 5 groups of ectoparasite. So you will start with, for example, you will start with cattle. You will say cattle, we have these 5 groups of ectoparasite. Group number 1 is so and so, group number 2 is so and so, group number 3 is so and so, up to 5. And then you will say, so this group number 1, which is so and so, the pharmacological treatment which is used for that ectoparasite is this and this. So you will mention the type of the ectoparasite group and also the treatment of that group of ectoparasite. So you will do that in cattle, in goat, in pigs, in dogs, and in cats. So you will write your work. So remember, we have 5 animals and 5 groups of ectoparasites. So it's a little bit some kind of a job to do. And you will write it. You write by your handwritten, and then you scan the document by using your phone or by using a scanner. By using your phone, you can download the applications like Tap Scanner and so forth and scan your document. And when you are scanning your document, please, you must know how to indicate page 1, page 2, page 3, page 4. So it will be easy for me to read through those pages. So if you don't understand, tell me, I will explain to you, or I will show you how to scan pages in the Tap Scanner or whatever. If you don't know, if you know, it's good. But if you don't know, tell me. I will show you how to scan pages, that the document will appear the first page, second, the third, and so forth. Some of you, they will scan 1 page and save, second page and save. So if you have a work with 10 pages, you will send it to me 10 different scanned documents. That is absurd, and it is a kind of a work to read and combine all those things. So what you are going to do is to scan page after page. So you scan it page after page in 1 document. So you will send me 1 document with pages, 1 PDF document with pages. So that is it. So if you don't know how to do that, tell me, I will explain to you. I will send you the video that shows how to scan a document in pages. So you will send that scanned document to my email. This is my email that you will use. Scan that document and send it to me. So we have 5 animals, 5 groups of ectoparasite. So it is Wednesday. Then the deadline of submission is 30th of April, which is Friday. So Wednesday, Thursday, Friday. I think it will be ahead of a job. So let us make it maybe up to Monday. That will be better. So up to Monday, in which Monday will be the 4th of May. So that will be 4th of May. That will be better. Okay, let us change the deadline. 4th of May, because I can see the job is not easy. There are so many animals with so many things. So up to 4th of May, and now it won't be at, it will be at 14 hours. So make sure you submit your document at this, also up to this time, 4th of May, up to this time, submit your document. So after this time, it will be too late. So don't be late, submit on time. And how to send the email? The place to send to create a new email is like this. So in the recipient, you will write my email, and in a subject, you will write your name, full name, registered name, and your registration number, NS number. And don't write anything in the area of subject. Just enter the recipient, which is my email, write your name and registration number at the area of subject, and then you attach your document. End of story. Don't write anything else. Do not write anything else. Just your name at the area of subject and your registration number. Then you attach the document, you send it to me. So that is it, and that is the end. You can do these questions for your own practice. Then thank you.